Is there any chance of rabies through milk of infected animals? Yes, it is one of the most frequently asked questions. Of course, globally, there are no records of rabies being gained by consumption of milk. The reason being, our oral cavity is full of lysozyme, and this lysozyme readily dissolves the cell wall of the rabies virus. But theoretically, I said the chances cannot be ruled out, because if there are any abrasions, there are cuts or ulcers in the oral cavity, definitely, theoretically, there are chances of rabies. But WHO clearly says that if there is a oral consumption of milk from rabid animal, post-exposure prophylaxis is not required, not essential, because there are no sufficient scientific evidences for rabies being transmitted through oral consumption. Question number 2. If a lactating cow is bitten by a rabid dog and cow is under post-rabies vaccination protocol, then after how many days milk can be consumed by both human and calf? Of course, there is no defined withdrawal period for this rabies vaccination. Immediately after having, the calf can consume the milk. Once the colostrum feeding is stopped, then the human can consume the milk from a cow which is under treatment. And I'll put it very specifically, if the cow develops rabies symptoms, then it should not be consumed. If there is a needle prick of anti-rabies vaccine to the vaccinator at the time of vaccination, is there any sort of hazard? No, definitely. Throughout the globe, none of the rabies viral vaccines have live viruses. It is all killed, inactivated virus. They are not attenuated. They are inactivated or killed viral vaccines are available. So there is absolutely no risk in such cases. Do sheep and goats suffer with rabies? Yes. If yes, what are the symptoms? They'll have repeated bleeding. They'll have repeated, nymphomania. They will have changes in their gait. They will have, head butting, head pressing. All these symptoms can be seen in sheep and goat. With a history of rabid dog bite to sheep and goat, what should we do? Same thing, whatever I have explained holds good. You have to first do wound toileting, wash the wound thoroughly with water and detergent soap, and then you have to go for vaccination. We use only intramuscular vaccination, so 037 14 20 is the recommended intramuscular vaccination. Of course, immunoglobulin therapy is yet to be incorporated in veterinary profession. If the meat or milk is consumed from asymptomatic sheep and goat which dies at a later stage with rabies, any danger? Yes. Once symptoms are exhibited in sheep and goat, what to do? In sheep and goat and cattle, usually I don't suggest euthanasia. So definitely 2 to 3 days they're going to die. In case of patients who are non-cooperative, the patient owners, especially non-cooperative patient owners, you may have to take a call on euthanasia, but I don't usually suggest euthanasia. Is there any danger if a sheep and goat which is rabies positive bites shepherd? Of course, there is rabies. Even sheep saliva will also have rabies virus. Any animal for that matter, if it bites, even a non-biting animal, if it is turned out to be rabies and it bites a person or a patient, definitely it has to be taken very seriously. On trying to handle the sheep and goat bites, yes, it has to be taken seriously. When the dog bites month-old pup, can we go post? Yes, when a dog bites 1 month-old pup, can we give post-bite ARV? WHO has identified some of the countries like denoted as endemic countries. In endemic countries, we have to give vaccination to, we have to start vaccination irrespective of age. 1 month-old puppy, maybe the mother is fully protected and vaccinated, but we do not know how much of maternal antibodies have been acquired from the mother to the puppy. So definitely, even a day-old puppy is bitten by a rabid dog or whatever dog it is, you have to start giving post-exposure vaccination to that particular puppy. Usually, I advise farmers with dog bite cases immediately wash the bite wound thoroughly with lukewarm water mixed with common salt and washing soda or washing soap. Is the primary treatment. Anti-rabies vaccination is the second action. Is it right or not? Yes, you're partially right. Common salt and washing soda has very little to do with it, but washing with soap, absolutely correct. As soon as you get a case of rabies, dog bites or any animal bites, you have to recommend the owner or farmer to go for a wash with continuously flowing cold water and detergent soap, preferably detergent soap, the soap which we use to wash clothes, and vaccination is compulsory. What will happen if a rabid dog bitten animal does not receive any post exposure ARV but wash the bite wounds with the lukewarm water mixed with common salt and washing soda or soap? Is there any chance to get rabies? Definitely there are. If you don't vaccinate it, the possibilities are very high. Washing, wound toileting will kill only 99%. It is said that only 99% of the rabies virus which has been inoculated through the wound will be killed by this wound toileting. That, like, washing the wound with cold water and sufficient detergent soap and application of surface, antiseptics. But even 1% of the virus is dangerous, so vaccination has to be taken up. Is it necessary to get vaccinated self after a puppy or dog which has been vaccinated against rabies? Yes, this is a very tricky question that you have to, take a call upon. See, if you're pre-vaccinated, then I would say, you don't have to worry about it. You can just take a tetanus toxoid and then stop. If you're not vaccinated, better to go for a vaccination. See, earlier there was a concept that, if a dog bites, you wait for 10 days to, dogs to show the symptom and then you go for vaccination. No, within 24 hours of vaccination, dog bite, you have to go for vaccination. So you can't wait. When you wait and it's already late, you're nowhere. You're in a serious trouble. So definitely, even if a vaccinated puppy bites you, if you're not vaccinated, don't take that risk. You go for vaccination. Can we do preventive vaccination in large animals with ARV? Of course, yes. Large animals do produce a good protective immune response, and based on the economics of the financial status of that owner, you can definitely go for pre-exposure vaccination. How many doses, how effective they are? They're absolutely effective. WHO recommends human vaccination, pre-exposure vaccination at 0, 7, and 21. Same thing can be followed in humans and in animals, even in large animals. It gives a good response. What is the maximum time to start post-bite vaccination? 24 hours, within 24. Earlier, the best. What precautions should farmer take while milking rabid dog bitten animals? Yes, he has to wash his hands properly after the milking. He has to wash the animal's udder properly with preferably with soap before milking. And if the animal starts showing symptoms, I would not recommend the animal to be milked. Anyway, it is going to die. You have to take a call. Rabies virus is secreted in milk. Yes, it is secreted not only in milk, all excretions and secretions of the body. It is there in sweat till the semen, and it is seen in feces, it is seen in urine, it is seen in milk, it is seen in everywhere, all secretions and excretions of the body. It is seen in bile, it is seen in pancreatic juices, everywhere. Whichever organ is innervated, all organs will get rabies virus. Will the milker or consumer taking raw milk suffer from rabies? Yes, this question I have already explained. If saliva of rabid animal has contaminated with water kept in a vessel, will the other animal drinking simultaneously of that after 1 to 5 minutes of contamination of water suffer from rabies? Yes, exposure to cold water for long duration definitely will kill the virus, and oral transmission of rabies virus is not being proved. So I think these two statements answer this question. If the rabid dog dies, how long virus will be infective from the dead carcass? Yes, wonderful question. See, it depends on how fast the animal is, dead body is putrefied. The virus cannot live in putrefied body. Virus will also go for inactivation, but a body being thrown or lying free in a cold environment will definitely delay the process of decomposition, and the virus will prevail a longer period of time, whereas a body kept in a hot and humid condition will putrefy faster and viral will vanish very faster. What is the available method to detect presence of virus in saliva? Yes, I have told you all those tests except for fluorescent antibody test and direct rapid immunohistochemistry test can be used for virus detection in saliva. That is, you can use PCR, you can use RT-PCR, you can use loop-mediated isothermal amplification, and for certain extent, even the lateral flow assay can also be used. But absence of virus in saliva is not a confirmatory test, because you always know only when there is a squeezing of salivary gland, the virus, saliva is secreted into the oral cavity. And because there are a lot of enzymes in the oral cavity, only for a small period of time, the virus will, prevail to be, will stay to be active in the saliva. That is why many of us would have noticed that, a rabid dog keeps on biting all the many animals, but only few animals will get disease, not all. Even though they are not vaccinated, even though all the animals are not vaccinated, only few will get disease, because not all the bites will have rabies virus. Not every time the saliva will have rabies virus, active rabies virus. So oral enzyme activity will also destroy this virus. So salivary sample can be tested, but absence of virus in saliva is not a confirmatory that it is negative for rabies. Which form is common in sheep and goat and in cattle? Sheep and goat, you have, it is very difficult. Form of disease is explained only in dogs, not in other animals. So you have all overlapping symptoms like, repeated bleating and headbutting and attacking behavior, aggression, all that is seen in sheep and goat. And dogs, you have two different forms. Rapid test kit to check virus in saliva. Yes, for some extent it can be used. I answered this question. It can be used, but I again say negative in rapid test kit, that is lateral flow assay, is not confirmatory that the case is negative. Preventive vaccination protocol in dog. Yes, I have told you, for first time when the animal is getting vaccinated, you have to give 0, 7 and 21 and then annual boosters. Post exposure protocol, that is in dogs, we follow only intramuscular regimen. So SN regimen has to be followed. 0, 3, 7, 14, 28 has to be followed. Use of immunoglobulins. Yes, in humans, it is well established and it is proven to be 100% effective. There is a question called as effect. So it is very, very effective. But in animals, there are some clinicians who are trying it. They have got good results, but it is not very well established in animals. If the dead animal thrown in water pond, stagnant water, or rabid live animal sheds saliva in flowing water, is there any chance of spread through drinking water? No, absolutely not. What are the available vaccines in market? Cost, doses, and route. Yes, you have umpty number of vaccines. Raksha, which is very popular also, and you have MSD manufacturing this Novivac rabies, and most of them, we have definite, Defensar and all that vaccines. Most of them, they range from 20 rupees per dose, and the expensive vaccine for animals will cost you about 280 to 300 rupees. And for human vaccines in Karnataka, all the primary health centers, not let alone this community health centers at taluka level, every facility has this anti-rabies vaccine, which has to be paid 100 rupees per APL, above poverty line beneficiaries, and below poverty line beneficiaries, it is free of cost in most of the hospitals. Why vaccination for pups is advised at 3 months of age? No, in India it is not advised. Irrespective of age, it has to be, the pups have to be vaccinated. Is rabies vaccine of human and animals is different? Yes, definitely. Human rabies viral vaccines are developed in purified chick embryo fibroblasts or vero cells, whereas animal vaccines are developed in, BHK, baby hamster kidney cell lines. They're definitely different. Inactivation agent used are almost same. So they use beta-propiolactone as an inactivating agent, but the development of vaccine is completely different. What is the immunity period of rabies vaccine? Potentially, it is said that it has to protect you for 1 year, because rabies virus, I already told you, it is a killed virus. As per theory, as per immunology, none of these killed vaccines are effective for more than 1 year. But some of the human vaccines, they say, and some of the Bowling and Ingham vaccine, even for animal vaccine, they say if you give it for once, complete dosage for once, and then you forget for 3 years. No, immunology or theoretically it is not possible. By using DNA-based test kit, is it possible to differentiate infected animal from vaccinated animal? Of course, it is not a DNA-based, it is a RNA virus, so RNA-based test have to be done. Yes, definitely you can differentiate infected animals from the vaccinated, because we are using a fixed virus in vaccine. Usually, either Dr. Largy's strain or some other strain will be used in vaccines, whereas in in an infected patient, you will have a different types of genotype 1 viruses. Of course, there is not much changes, but only thing those conserved regions have to be targeted. Definitely you can do it, but of course this is not a matter for scientific research, because infected or vaccinated, there is absolutely no possibility that a vaccinated animal will get disease from the vaccine. Because of the vaccine, the animal cannot get disease, because all these viruses have to be inactivated before they are put into vaccines. So vaccine acquired infection is definitely not possible. There is a stage of viremia as written in a book. No, absolutely there is no stage of viremia. Virus excretion in urine, yes, virus will be there in urine, but there is no stage of viremia. Virus is never ever seen in blood. Rabies in cattle ruminants, is zoonotic or not? Yes, if unfortunately a animal handled, if you put hand in its in the rabid cattle or ruminant's mouth, and he gets bitten by that, definitely it can be infective. But ideally, as per books, cattle are said to be the dead end host, because they do not have a biting tendency. In saliva of rabid affected sheep, is it infectious? Yes, it is infectious. If rabid sheep bites shepherds, is it dangerous? Yes, this question already I have answered. It is dangerous. Will rabies affected sheep and goat abort? Yes, this is a matter of chance. There is no direct relation between rabies and abortion. Of course, it can abort or it cannot abort, but there is no direct relation to rabies and abortion. Will affect did the sheep transmit rabies to another sheep in same flock by licking or biting? Yes, if it bites, definitely. By licking on an open wound, definitely it can. But licking on other areas, definitely it cannot. If a rabid affected human being bites another person, what will happen? Definitely the bitten person, if he doesn't take proper care of wound, and if he doesn't take up this post-exposure prophylaxis, he'll definitely get rabies. Is milk from rabid cattle consumed after boiling? Yes, absolutely no problem. Boiling will destroy all the viruses. Is brain also infectious on handling? Yes, definitely. Definitely, brain is very, very infectious on handling. If vaccinated dogs bite, what schedule must be followed? Of course, you have to take a call. See, it always depends on how confident are you on your vaccination schedules, and how confident are you on your patient that it has not come across with any kind of dog bites. Is curd from rabid animals milk safe to human consumption? Of course, curd will ferment milk. Definitely, the rabies virus will die. So it is safe for human consumption. Sir, is there any contraindicatory effect of using NSAID, SIDs, and antibiotics along with vaccines? Yes, some people recommend not, use of, to restrict. Some people recommend to restrict use of steroids steroidal anti-inflammatory and non-steroidal anti-inflammatory drugs. But as per immunology, there should not be any problem. Can we drink milk from a cow whose calf is bitten by rabid dog as milking is done while calf is suckling? Yes, this is again a very, very, very theoretical question. Of course, you have to observe, and if the calf is bitten by a dog, and better to avoid, directly allowing the calf to the udder. You can definitely feed it with the bottle or something like that. What will be the vaccination protocol when vaccinated animal bites to other vaccinated animal? Yes, again, it's a typically hypothetical question, and the biting on the biting vaccinated animal should be very clear that there is no exposure to the other dogs. If the dog which bites has no exposure to other dogs or any bite histories, so you don't have to go for really worry about vaccination. Sir, you said 3 vaccines for the first time. In dog vaccine, there are done at 90 to 120 days vaccines. No, that is wrong. That is wrong. So ideally, in recent past, it was being given at 0 and 21 primary doses to dogs, but it is recommended that you give at 0, 7 and 21. Can human animal vaccine can be used vice versa or not? No, they cannot be used vice versa. Human vaccine has to be used only in humans. Animal vaccine has to be used only in animals. At what age first vaccine must be given? So ideally, irrespective of age, the vaccine has to be given. But in a very good dog having a very good history, you have to give first dose of vaccine at least before 3 months of age. Before 3 months of age, at least 1 dose of vaccine has to be received. If virus is not released to blood, then how neutralization of virus happens by antibodies? Antibodies are seen everywhere and everywhere. Antibodies are not only seen in blood. They can penetrate into each and every body part, every organ of our body. So antibodies neutralize even in muscle, even in eyes, wherever it is possible. This IgG. That is why we are creating an emergency. We want a IgG response. IgM is a pentamer. It has 5 molecules, which is bigger in size. Okay, so we want a smaller molecule called as IgM, immunoglobulin G, IgG, which can penetrate deeper into the tissue. So it can neutralize in anywhere and everywhere in the body.
Will the start of post-vaccination regime, a dog is bitten,
okay,
will it guarantee us from totally safe?
Sir, if you follow all these procedures, wound toileting, I said wound toileting is very, very essential. Okay, if you have very much confidence on the owner, and as soon as you have received this patient, you have identified. See, especially in dogs, it is very difficult to identify the bite marks because they are all hairy. Identifying each and every bite mark is very difficult. So if you have done all that, definitely you can be very sure that the animal will not get disease. Only the exception is if the animal is got bite on the head, which is very close to the brain and spinal cord, then you cannot assure them. Otherwise, if you have taken care of all these things, definitely you can assure them.